It's day 2 of the series. So yesterday was just sort of a very gentle reintroduction to us moving, which I think most of us needed. But we're going to have this little ebb and flow with our sessions, which is kind of like the way my body likes to work. You know, it's nice to sort of ease into it, give yourself like a nice challenging session in a couple of days, and then sort of like ease out of it and back again. So that's going to be kind of the theme for the series as well. So we're going to obviously do a little bit of fascial release work, which is why I asked you guys to have the balls available for you. And other than that, you just need your mat. And then if you need a prop for underneath your head or underneath knees or back or anything like that, then just have a cushion or a folded up towel available for yourself as well. Okay, so guys, we're going to start in a standing position today. And you're just going to take your ball and we're going to have it just on the ground in front of us. So you're just going to place it onto the floor like this. I'm going to move off my mat just because of where my video is placed. But you guys can stay on your mat with the ball in front of you. So line up your feet. Make sure that they are level with each other. Just allow your arms to relax. Lift your gaze so that you are looking forward. And then take a moment to just sway on your feet. So you can maybe rock forwards and backwards slightly. And then maybe rock from side to side gently. Bring yourself back to the center and then give yourself an opportunity to tune into yourself and pause. So I quite like to close my eyes here. If you prefer to keep your eyes open, then just allow your gaze to soften slightly. And taking just a few deep inhale and exhales. Noticing where you might be holding unnecessary tension today. Notice how your energy is feeling this morning. Remind yourself of the intention or the dedication you would like to carry through with you over the next 4 weeks. And then gently blink your eyes open to clear your vision. Soften your knees, and on your next breath, just look down towards your feet and roll halfway forward through your spine, rolling down just until your hands are in front of your knees. Notice that stretch along your back and spine. And then continue rolling forward so that your hands come towards the ground. And notice how the stretch probably has moved towards the back of the legs. Where are you feeling it today? Take a little breath. And then back up you come into a standing position using abdominals. Come all the way upright and lifting nice and tall. Take a moment to roll your shoulders around. Get that sensation of opening across the front of your body, clavicles, heart space, and then just allow your arms to settle. We're going to stand on our left foot, find balance, and then place your right foot lightly on top of the ball. And start to roll your foot around. Now, if you're losing balance, just put your hand on the wall or a chair, something to balance on. But you almost want to feel like you are tickling the bottom of your foot. Get all around your foot. So some of you have done this work with me before. We are getting into the very first layer of fascia underneath the skin. So it doesn't have to be a heavy movement. Very, very light. And then keep your foot relaxed and start to put a little bit of heavier pressure. So you're keeping a floppy foot, so the focus here is a little bit more on the muscles of the feet. So we're getting into those intrinsic muscles. And then keep that pressure and stiffen up your foot. So now with a stiff foot, as you roll around on the ball, we're getting into those deeper layers of fascia, and that is the plantar fascia of the foot. And then before we move to the other foot, just step back, stand, allow your eyes to softly close or soften gaze, and notice how your right foot, how the right side of your body is feeling right now. Is there a shift taking place for you? And then you can blink your eyes open again. And now balance on your right foot, light movement of the left foot rolling on the ball. So see if you can get over the entire foot from the heel all the way to the toes, maybe a little bit to the outside blade of the foot, to the inside step of the foot. And then let your foot go soft and start to put a little bit of deeper pressure. So we're repeating what we did on the first side. Getting into the muscles of the foot. And now stiffen up your foot and keep that heavy pressure. So we're getting into the plantar fascia, that connective tissue. So it can be quite intense. If you find a point that feels quite sensitive, you might just want to almost like step on it and hold the pressure and breathe, if that feels okay for you. And then you can release. Take a moment to just stand, closed eyes, soft gaze, and simply observe yourself for a moment. Notice that left foot. How does it feel? And then blink your eyes open. We're going to repeat our roll down. We're going to nod chin, coming halfway forward, just until the hands are in front of knees. Stay there. Notice how it feels. And then start rolling all the way forward. Maybe you can touch your fingertips or hands to the ground, but don't force it. Relax your neck if you can. And then exhale, come all the way back up. Use your abdominals, use your bum cheeks, lifting up and focusing your gaze. And again, we're just going to roll the shoulders back and around. You can stay as you are. I'm just turning to face you so you can see what I'm doing. And you're just going to let your arms settle. And now from here, take both your arms. We're going to inhale to reach up, fingertips touch, and exhale, open your arms nice and wide. Fingertips touch at the bottom. And again, breathing in, reach up. Feel how your ribs lift up and separate. And then exhale, open your arms wide. Keep your knees soft so that your lower back is easy. One more time. Inhale, reach all the way up. And this time, exhale to stay where you are and just allow your elbows to soften and relax through the shoulders. Bring your right arm down. So I'm doing a mirror image for you. Bring your right arm down. Start leaning over towards the right, pushing your left hip to the left. Relax your head, and we take 5 gentle pulses. Getting the lateral line, getting that elastic quality. Hold, come all the way back up. And now bringing that right arm up, connecting fingertips. Drop your shoulders, bringing your left arm all the way down beside you, leaning over towards the side, letting your hip push towards the right, relax your neck, and we pulse. One more. Come all the way up. Inhale, lifting both arms up. Connect fingertips. And then open your arms and allowing them to settle down. Pause there for a moment. I'm just coming onto my mat. You guys stay where you are. Take one more breath in. Exhale, nod your chin, and let's roll halfway forward, just until hands are in front of knees. Stay here for a moment. Come all the way forward, fingertips towards the ground. Stay here, relaxing your neck. And now walk yourself down onto all fours. So you're kind of going to have your legs on either side of that little spiky ball, which is resting on the mat still. So set yourself up. Hands below shoulders, knees below hips. On your breath, round your spine. So you're coming into a cat stretch. Abdominal muscles are connected. Belly button is lifted. Lengthen your spine. And let's see if we can start to move towards extension. Lift tail, heart, and eye line. And again, using your breath. So we've done a little bit of flexion movement already today with our roll down, but this is going to feel different in our connections because we are now horizontal to the floor and we have gravity acting in a different way. So the abdominal muscles really have to work and we are mobilizing through the spine. Let's take one more time, rounding your spine up. And this time, just come back to a neutral position and hold it here. Slide your right leg back, keep your toes on the floor and level your pelvis. Walk your left fingertips forward, keep your shoulders level, stay for a moment. And then on your breath, pick up your arm and leg and you balance. So oftentimes we talk about the connection between fingertips and toes on the leg and arm that's lifted. I'd like to also bring your awareness to your right hand and your left lower leg that are on the ground. They are your foundation right now. Take a breath and then bring hand and knee all the way back in. Same to yourself. Take your left leg back, hold it there, level yourself out, walk your right fingertips forward and then hold it there. And once again, as you lift your arm and leg, be aware that you don't drop into the abdominals. You want to keep the abs connected to support the shape of your spine. Become aware of your hand, your knee, your shin, your foot that are connected to the ground. Take a breath and then bring hand and knee all the way back in. So we're going to stay on all fours. I want you to take that little ball and put it underneath one of your shins. It doesn't matter which one because you're going to be doing both. And start to roll your shin up and down the ball. So you might need to go on the bone itself. You might want to go a little bit to the side. I think you'll very quickly figure out what feels good or where you need the release. And if possible, come all the way down towards the front of the ankle and the top of the foot. There is a huge amount of connective tissue at that area. It's called the retinaculum. And it helps to stabilize our ankles and it helps us with our balance. And then release before you do the other side. Kneel on all fours. Close your eyes and just observe how the two different sides feel after you've just done that rolling. So my one side feels very awake, almost tingling. And then move over to the other side and feel free to move your hands. If you need to come down onto your forearms, if your wrists are getting sore, then give yourself permission to do that, okay? So rolling around on the shin, come as high up towards towards the knee as you can. Go as low down towards the ankle and the foot as you can. Pay attention to any spots that you feel might need some TLC. And then center yourself. This time you can move the ball just a little bit over to the side. And once again, all fours, close your eyes and just notice how the two sides feel around the lower limb. Blink your eyes open. Slide your right leg back. Hold. Walk your left fingertips forward. Hold. Lift up arm and leg. And once again, balance. So as you stay here, start to notice if your balance is any different after that rolling. Do the connections to the floor feel any different along your shin, your foot, your knee? And then bring hand and knee all the way back in. One more time. Here we go. Left leg back. Walk the right fingertips forward. Lift your arm and leg. Pause here. Bring your awareness to the hand, the lower limb on the floor. Feeling the connections along the front of the ankle, the shin bone. And on your next breath, bringing hand and knee all the way back in. Open your knees wide. Sit your hips back. Bringing your forehead to the ground. Bend your elbows. And just take the pressure off your hands and your wrists. Maybe give your hands and wrists a little bit of a wiggle. And then just let them settle. We're going to take 4 breaths in and out in this position. And again, taking an opportunity to check in with yourself. And in this shape, how does your body feel? Where are you feeling any tension? How does your breath feel today? And taking one more breath in and out. Slowly draw yourself up onto all fours. Once again, onto hands and knees. Now, you're going to take your right leg back. You're going to lift that leg up. And now you're going to step your right foot to the outside of your right hand. And then send it back again. And again, step forward. And send it back. So just keep going. This is a very functional movement because we are flexing the hip. So anytime we walk up and down stairs, this is the movement. Anytime we get in and out of a car, we need this movement. Anytime we sit up and down off a chair, keep the abdominals connected. Is it getting any easier for you? And let's just take one more time. Step your foot to the outside of your hand and you stop. Start to toe heel your foot onto your mat. Give yourself padding underneath your knee if you need. And then walk your hands all the way up so that you are now in an upright kneeling position. Again, you want to make sure that your abdominal muscles are connected, so you have a little bit of a posterior pelvic tilt, and then do a little bit of shifting of your body weight. So as you come forwards, you might feel an increased stretch. You might feel that it's pulling in your lower back, which isn't exactly what we're looking for. So if you feel that you need to stay back a little bit, then you stay back. So now settle yourself into the position that feels good for you. Let your hands come all the way down. Balance yourself. We inhale to reach all the way up. And we exhale to open arms nice and wide. And again, inhale, reach up. Exhale, open up nice and wide. Taking 2 more, we breathe in. Exhale. One more time, breathe in. This time, exhale to just bring your right hand down beside you. Start leaning over towards the right, so you feel an increased pull along that hip and that muscle at the side called the TFL. And let's do 5 little pulses. Hold it. Come all the way back up. And on your next breath, bring your hands all the way down so your fingertips are just on either side of your foot. Let's do our little shifting backwards and forwards. If you need to move your legs wider apart so you've got more space, then please do so. So this is a very gentle hamstring release. Long spine, shoulders away from the ears. And we're going to do something just a little bit different today. You're going to stay back there, lengthen your spine as much as you can, keep the front knee soft, and all we're going to do is lift the toes and place the toes down. And again, flex the ankle and release. Lift. Keep lengthening your spine, shoulders away from the ears. 2 more. Lift and release. One more time. Lift. Now, take your foot a little bit out to the right and then draw a circle down to the floor and into the left. Down to the floor and out to the right. Circle down and in. Circle down and out. Let's do a few more. Long spine. One more set. So it's a half circle. Come up to the center, hold it. Place your foot down. Bring your hands all the way down to the inside. Toe heel, so your foot goes to the outside of your mat again. Separate your hands. Send that leg all the way back. Pause here for a moment. Take a breath in. And then exhale. Bring that knee all the way in. We're going to do the left side now. Stretch your left leg back. Lift your leg up. And then when you're ready, step wide to the outside of your left hand and send it back. That's it. So just keep going, finding a gentle rhythm, becoming aware of the abdominals supporting your movement, hip flexors, allowing it to become smoother and easier as you do the repetitions. Let's do one more time. And pause. Toe heel your way in onto the mat. Bring your hands up onto your knee. Lift your eye line. Remember, if you need any padding underneath your knee, give that to yourself. If you need to take your feet wider apart, you can do so. And that little bit of a shifting to get that opening into that right hip joint. Abdominals are gently connected. And just an easy rhythmic movement. Settle into the shape that feels best for you. Release your hands down. Take a moment to find your balance. And we go. Breathe in. Open your arms nice and wide and clear some space. Breathe in. Reach up. And breathe out. Let it go. 2 more. Last one. Breathe in. And this time, just bring your left hand down beside you. Do a little bit of a lean over towards the left, and 5 pulses. Keep it smooth so there's no jarring action at any point. 2 more. 1 more. Release up. Both hands come up. And then reach down and place your hands on either side of your foot. And moving back and forwards. So my hamstrings are feeling a little bit tight from yesterday's session. I hadn't done anything for a while before that. So don't force it. You'll start to notice as you move and you get that gentle rhythm that it releases a little bit more each time. Last 2. And then moving hips back, hold it. Lengthen your spine. Soften the front knee. Lift your toes up and down and lift. So this can become quite neural if you're tight along those hamstrings. So again, just go as far as you can. Lift up, hold it. Now take your toes a little to the left and then circle down and to the inside. Down and to the outside. So it's a little half circle movement. Last 2. Last 1. Bring your foot back to the center. Place your toes down. And you're going to now move your hands to the inside. Toe heel, bringing yourself wide again. Bring your hands below shoulders. Send that leg all the way back. Stay there for a second. And then bring your knee in. Settle back once again into a resting position. Bringing your head all the way down. And this time, see if you can maybe bring your hands out a little bit more. So you're starting to stretch the elbows. And again, opportunity to pause. Observe yourself. Integrate the movements and the releases that we've done so far. And taking just one more easy inhale and exhale. And then draw yourself up onto all fours. Now we're going to be going into a plank position. So get your shoulders in a happy place above your wrists. Bring one leg back and tuck the toes under. Take the other leg back, tuck the toes under, and we're simply going to hold it here. And this is one of the most amazing, very, very simple, but an effective way for us to find symmetry and balance between the front and the back lines of our body. So if your hips are hinging up, you are shortening at the front of the hip and you're lengthening at the back of the hip. Can you bring it down? If you're going the other way, you're doing the reverse. Find symmetry. Let your knees come to the floor. Relax your feet out. And now ever so slowly bend your elbows. Lower yourself all the way towards the ground and hold it here. Now, stretch your left arm out to the left. Turn and look away. Bend your right knee. And then give a little push with your right hand as you roll your leg up and back, looking for the ground. If you don't touch the floor, don't force it. So there's quite a lovely rotation of the spine, but the point of this is to get a stretch and an opening along the left chest, the left shoulder, and down the left bicep and into the hand. So just stay here, relax your head and neck. Few more seconds. And then on your next breath, roll yourself slowly all the way to the center. Switch over to the other side. So now your right hand reaches out, you look to the left, bend your left knee, give yourself just a little bit of a push, a little bit of a nudge as you roll back. And you don't have to keep your hand in a set place. If you feel that you need to move it, do so. Just make sure that you don't have pressure on the shoulder joint when you do move your hand. Just breathing into it for a second. Let gravity do its work here. And take another little breath. And on your exhale, come all the way back to the center and then stretch your leg out. So take the little ball and we're going to put it just in the middle of the sternum. So it's not exactly the most comfortable position to come into, but you want to be able to round your back over the ball so that you are resting your head, bend your elbows, and then just find a happy place for your legs and lower back and start to do a little bit of a rocking action from side to side. So again, we have a huge amount of connective tissue that goes across the chest at the sternum, and we've got some massive muscles like the pec major that connect into it. So considering how we have this habit of rounding over so much, this can all get very shortened and tight. So this is a lovely way to release it. And then just center yourself. Firm up your bum cheeks to anchor your pelvis. Hover the tip of your nose so you can breathe. Lift your eye line up. And then on your next breath, just nudge the ball a little bit forward with your breastbone. It doesn't have to be a huge lift. Take a breath in, release, and allow yourself to come all the way back over the ball. Move your hands if you need to. Lift eye line. We're coming into a baby cobra. Nudge the ball forward with your sternum. And then releasing all the way down. And we're just going to do 2 more like this. Lifting eye line. Sending breastbone away from the heels of your feet. And releasing down. Last one, lifting eye line. Gently coming up. Stay for a moment. And releasing all the way down. Good. Now, take the ball out. And before we go anywhere, I just want you to rest. You can turn your head to the side if you prefer. But notice how there's been a release on the front of your body. Has it been a significant shift for you? Has it been a very small shift? Just notice yourself. And then bring your head to center. Lift your elbows up so you can push into your hands. We're going to come up onto our knees. So tighten abdominals, press up, tuck your toes, and then lift up into a downward facing dog. So if you need to move your feet forward, you can. If you want to move your hands and feet wider, you can. And you're just going to walk the heels one at a time down towards the ground. And then press both heels towards the floor. So just hold it there for a moment. And we're going to be going into what's called the pigeon stretch. So pick up your right leg and then bring your knee forward towards the right side of your mat. Swing your foot across the mat and then slide yourself back. So the more horizontal that you bring the shin, the more intense the stretch is. So you can decide how far to take it. Try to keep your pelvis level. If it doesn't If your knee doesn't like it, then shift it. And then bring yourself down into what is called the sleeping pigeon. And we're just going to breathe. And again, if you want to put a little prop underneath your right bum, you're welcome to do so. Because we're going to be staying here for 8 full breaths in and out. Just allowing yourself to sink a little bit deeper into it. And it's a little bit of a tricky one because we want to be able to go into a stretch. So stretches are out of our comfort zone. So you're going to experience some discomfort, but you want to know that it's not pain. There's that distinction between the two. And then allow yourself to breathe. And taking just one more inhale and exhale. Start to walk your hands all the way up. Now, roll onto your right hip. And then you're simply going to step your left foot just in front. So it's not all the way across. Take your right hand, put it behind you. So you're literally kind of leaning into it. And then just let your left hand dangle on top of your knee. So it's a very sort of comfortable, slouchy position. You're not actually forcing yourself upright in any way. Bring your left hand just to the inside of your knee. And as you breathe in, grow a little taller and just rotate softly towards the right. And then exhale and sigh back. And again, inhale. Exhale. So it's a very gentle movement. So it's pretty much the same as doing any twisting action that we might do in Pilates or yoga, but we're not forcing it. It's more of a spiraling action as opposed to a twisting action. Last two, using your right hand behind you to help and support. Last one. Breathing in, breathing out, and coming all the way upright. You're going to now spin your right leg around to the back, and we're going to come into that pigeon pose on the other side. So get the angle of your knee happy. Walking your right leg back. Try to get your pelvis as level as possible. Come down onto your forearms. Sleeping pigeon, and then once again settle into the stretch, the release that feels good. Give yourself a prop if you need. Double check that your knee's okay. Discomfort is fine, pain isn't. 8 full breaths in and out. Taking just a few more breaths. See if you can sink and release a little bit more. And then on your next breath, start to walk your hands all the way up. Move your hips over to the left side, stepping your right foot around. So it's quite an open seat right here. Left hand supports you. Just rest your right hand on top. So it's a very sort of slouchy, relaxed position. And then move your hand to the inside of your knee. We inhale, spiral. And we exhale, sigh. And again, inhale. And release. Breathing in. No forcing. And release. So it really is when you inhale, there's this expansion from the inside of your body that travels outwards. So it's an internal release. And then settling back. One more time, breathing in. And releasing back. From here, just step that left foot forward. Maybe come a little bit more forward on your mat. Make sure that you've got your ball closer up towards the center of your mat. Hold on to your knees. Sitting up nice and tall. See if you can almost lift your heart slightly. So it's a little bit of an extension. And then curl back. Go back enough that you feel that you can hang into it slightly. Very little work here. Bend your elbows, pull forward. A little bit of a release at the top, breastbone up. Curl back, draw your tail under and abdominal muscles connecting. 2 more. Bend elbows. Lift up, high release through the breastbone. Curl back. 1 more time. Little high release. Curl back. And I want you to stay here. Find your core connection. You want to be able to maintain it. Hold on to it. See if you can release your arms. And now roll yourself all the way back with control and allow yourself to settle. So either walk your feet a little closer to your bum or your bum a little closer to your feet. You're going to have knees and feet hip distance and arms are just resting beside you in a comfortable place. We are going to pelvic press today, not pelvic curl. Take a breath. Exhale as you hinge your pelvis up so there's no articulation of the spine. That means the workload has to come directly to the back of the legs. Take a breath in and then hinge your pelvis down. There's no rolling of the spine. And again, press up. So the lovely thing about this variation, hinging down, is that we are getting a co-contraction of the abdominals and the back muscles. As you press up, the deep abs called the TA, the transverse abdominis, and the deep back muscles called the multifidus have to work together to stabilize your spine. Let's take a few more. And hinge down. 1 more. Press up. And hinge down. Nicely done. Stay there. Bring both hands all the way up. Turn the palms of your hands to face each other. We start to scissor. Keep your elbows nice and straight. Keep your ribs closed so the abdominal muscles have to work. Relax the back of your neck and head. And allow your scapula to glide with the movement of your arms and hands. Taking just a few more. I'm sure some other people are listening to some clicking like I am. My shoulders are clicking like crazy. Bring both hands all the way up. Interlace. Place hands behind your head and pause here for a moment. Give your spine a little wiggle if you need. Elbows are floating. Nod your chin. And on your breath out, curl forward. So we are shortening, we are contracting the front line of the body. Take a little breath and releasing down. we contract the front line of the body, the back line has to release. It has to let go. And releasing down. No pulling on your head. Coming up, stay here. We're going to bring the right knee up to tabletop. Remember, we did this yesterday. And then release down, keeping your leg where it is. Coming up into a chest lift. So now we've got that front line shortening. We're going to flex the ankle. Can you feel how it switches on the front line some more? And then lower your head and shoulders all the way down. Come up into your chest lift. Front line is shortening. Now, how about you straighten that leg? Front line working a little harder. And bend your knee. Let's do that 3 more times. Extend. The front line is shortening. The back line is lengthening. And bend. 2 more. And bend. 1 more. And bend. Point your toe. Lower your foot. And release head and shoulders all the way down. Take a moment just to let the elbows settle back. Some deep breaths in so you can let your diaphragm stretch. You can feel your ribs lift. Those abdominal muscles getting a little bit of a reprieve. And then we've got another side to do. So elbows are floating. Give your spine a little wiggle. Nod your chin. Exhale, curl forward, and you hold. Left knee comes up, you stay here. So we're starting to shorten the front line. Lower head and shoulders down. Again, chest lift, stay. Flex your foot, and can you feel how it starts shortening the front line even more? And release. Who would have thought flexing the foot would load the abs more, right? It's all connected. Chest lift, and you hold. We extend and bend. Stay lifted. Notice when you straighten this leg that you're having to release the back line. So there's a balance between the 2 sides. 2 more. When you extend, you are loading the abs even more. And bend. 1 more time. Extend and bend. Point, lower, and release. And allow your elbows to stretch back. Oh my goodness. Hopefully I'm not the only one feeling that. Breathe into it. Find that little softness around the upper ab connection. And then releasing your hands out. Now I want you to hold the ball lightly in your fingertips above you. And we're just going to roll the ball into the palms of the hands. You can keep your elbows nice and soft. And then just pause and keep the ball above you. We're going to press the pelvis up again. Exhale, press up. Bring the ball around, place it under the sacrum, and then settle yourself down. Move it around so that it feels good. Hands out, and start to do just a little bit of a rocking action from side to side. And I was talking earlier about all the fascia on the sternum that all those muscles connect into. We have that same sort of flat band of fascia across the sacrum and the lower back. And we've got lots of different muscles that connect into it. So this can be a huge release for a lot of people in different areas. Bring yourself back to the center. Just stay here for a moment. Take a breath in. And then exhale. Press your pelvis up, slip the ball out, leave it beside you, and then lower your pelvis down. Stay here. Close your eyes for a moment and just observe how it feels. Has it been a significant or a small shift for you? Gently open your eyes. Take your hands a little bit wider than your mat. Wiggle your feet and your knees together. Start rolling your knees to the left. Keep your ankles together so your feet are going to lift up and your knees stay stacked. Turn your head to look the other way. And on your breath out, bring yourself back to the center using the abdominals. Taking your knees to the right. Let your left foot, your left hip lift up. Look to the left. And exhale, narrow your waist and draw back to the center. And again, rolling to the side, look away. Exhale. Rolling to the side, look away. Last two. Last one. Come back to the center and hold. You're going to bring both hands up. Stretch your legs out long. So yesterday we did a modified roll-up. Today we're going to do the full thing. If you need to modify, you do what we did yesterday with the hands behind the knees. How far back can you take your arms without letting your rib cage pop? Energy through fingertips and toes. Inhale, lifting your arms, lifting your head, breathing out. So make sure that your abdominals are doing the work, that there's no strain in your back. Today, let's go all the way forward. So just as a wonderful stretch. Take a breath in, and then exhale, unravel, and lifting all the way up and tall, and releasing your arms down. Turn to sit facing towards me. And you're going to just place your hand with your fingers pointing away, knees are stacked and your feet are split. You're just going to let your hand rest here. So let your shoulders shrug and then press away from your hand so you can feel that there's an active lat and oblique on the underside. Let's do that one more time. Shrug and then press up and hold it there. Now glue your scapula onto the back of your body, bend your elbow, and press up. So we're doing little baby push-ups here, one arm only, and it should give us a nice opportunity to focus on the precision of the movement. So your scapula doesn't move, the hinging is at your elbow, and you're keeping the abdominals connected so that your spine is stable. So ultimately, when we do this on all fours, we can apply all of this knowledge to that movement. Taking just a few more, and press. Last one, and press. And I want you to now come down onto your forearm. Settle here. Take one deep inhale as you reach back. And then exhale, coming into a thread the needle. Now you're going to be placing your right arm down as well. Let your hips settle, relax the back of your neck, slide your knees if you need to. And we hold this rotation of the spine. So this is a little variation of the thread the needle that we often do. Just relax into the back of your neck. Make sure that you can breathe into that rotation. And then on your next breath, walk yourself all the way up. Spin your feet around to the other side. So you're going to have your hand pointing away, knees stacked, split your feet, and we're going to let the shoulder hunch. and press away. Lats, obliques, find the connections. Feel your scapula lift up. Feel your scapula glide down and widen out. Glue it into position there. And tricep dips. And push. Bending the elbow. And press. So again, the elbow, like the knee, is a hinge joint. It's supposed to kind of move in one direction, but not everybody's elbows like to move in a particular way. So if this is hurting your elbow in any way, then please adjust the position. You can also do the same thing for your shoulder, yeah? We've only got 2 more. Obliques connected, 1 more. Press up, hold, come down onto your forearm. Reach up and back, give yourself a little bit of a stretch across your chest, and then threading the needle through. Let your forearm settle, move your knees if you need to. Relax the back of your neck so you can breathe. Last breath in and out. And then walking yourself all the way up. Pivot onto hands and knees. We're going to transition into a downward facing dog. So tuck your toes under. On your breath, hover your knees. Move your hips up and back. Do that little pedaling of the heels. Send both heels as low to the ground as they can go. And then walk your hands towards your feet. If you need to bend your knees, then go for it. And then just hang there for a second. Shake your head. No, 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 no. Nod your head. Yes, 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 yes. And then slowly unravel. Coming all the way upright into standing. Lifting your gaze, finding balance. Take a moment to roll your shoulders back and around. And then, just as we started, give yourself a moment to close your eyes, to check in with yourself. Scanning your physical body, scanning your energetic body. Observing any shift that's taken place in the last hour. Take a nice deep inhale. Exhale through your mouth. Blink your eyes open. Give everything a little bit of a shake. Beautifully done, guys. Let's just do a quick check-in with you.